Hi everyone, this is Neel Raithatha, consultant audiologist and director of Clearwax. Thank you for joining me in my latest video using the Waxscope. And here we have a patient, age 13, who has to attend at least twice, maybe 3 times a year to have their right ear clean. The left ear is fine. And the reason behind this chronic buildup are predominantly dead skin. It's not essentially earwax, it's more dead skin. And you'll see that as we begin to remove this plug of this obstruction from the entrance of the ear. It's twofold. First of all, they do suffer from eczema. So when you have eczema, they're going to have more dead skin forming and accumulating within their auditory canal, so their ear canal. And also they have got a very narrow ear canal entrance, so it almost somewhat prevents this skin, and if there is a bit of wax in the mix, from naturally migrating. So I'm having to really stretch the ear canal open using our medium-sized specular. And I've been treating this patient for quite a few years now, and there is a specific technique that you need to adopt. So what I'm doing first is just separating it from the edges, and eventually I'm going to go to the floor of the ear canal and I'm going to lift this plug. I always have to, it's just through years of seeing the patient I've developed the knack of how to particularly remove this. So I used to really struggle actually because of the consistency. It may not appear it now because it's been pretty straightforward now, but I'm going to go to the floor. I'm going to lift this off the floor, and so they've got this little trench as well. That's something else I should have mentioned. So just as we enter the ear canal, just past that bottom bit, and you will see that. I'm just trying to peel it from the posterior canal wall first. You can see how mushy and sticky this is. It's a horrible consistency actually. And that white glare, that's skin. So I could have turned down the brightness on the app, but it wasn't causing me a problem. But it's actually a good thing in a way, because it really identifies dead skin, keratin, or at least freshly secreted skin. So that skin is just shed, hence why it's white. Over time it will oxidize. So this is the bit, I just need to lift it from the floor, out of that trench, and we're going to now wriggle this slowly but surely out of the ear canal. And then when we re-enter, the patient's got a bit of crusted skin right at the center of the eardrum, so we're going to remove that. They've also got a thick layer of skin lining the region of the ear canal that we call the pars intern, which is the inner third. And because we put some oil in, there's a bit of puddle accumulated at the floor just in front of the eardrum, so the inferior recess, so we're going to remove that as well also. So that's that piece of skin, which is really oxidized. It's right in the center of the eardrum. So where we just remove that piece of skin, it's the region of the eardrum called the umbo, and that's the progenitor site. That's where all the skin cells that line the inner 2/3 of the ear canal are originally formed, from the center of the eardrum. And then this skin, it slowly migrates radially off the eardrum, and it slowly comes forwards towards the entrance, and it lines the inner 2/3 of the ear canal. So I'm just mopping up around the edge, particularly in this bit here. They've got a little trench just beyond that peak, so I'm just going inside, lifting that away. And then there's some skin anteriorly, so we're just on the front part of the ear canal. This is just where the second bend is. And once more, I'm having to really stretch the ear canal. Now, once we enter with the specular is opening up the ear. So when we use the endoscope, you don't have that luxury. You're having to use the endoscope at the same time as visualizing the earwax to open up the ear canal. So it's just a bit of skin here. We're going to peel that away. And then just a bit deeper. So it's going to re-enter. I'm going to stretch the ear canal. I'm getting the right-hand side of the specular, tucking it inside the second bend. So I got a good visual. You just see at the floor here. So I thought this was going to come away easily, but I had to put some more oil in. It's a thick blanket of skin. So the underside, the reflective side, is freshly secreted dead skin, and then on top of that is an older layer of skin that's oxidized. And it's quite tough actually. So I'm just going to put some oil in. And then that's just going to facilitate the removal of this. So there's a few hairs just entangled at the tail end of that skin. And the oil just helps, it goes underneath, it helps to separate the skin from the canal wall, just loosens it a little bit. And I'm just peeling it right to left. You can see it actually, some of it coming off the eardrum there in the distance. And then we're going to slowly bring this away. So I've mobilized it. I'm just going to drag it away. You can see some of the oil is coming out with it. I'm going to give it a little wriggle and it gets trapped. So as I come out of the entrance of the ear canal with the specular, the canal collapses. So it's just got trapped here. So I'm just going to, at this stage, I'm just actually looking into the ear with my naked eye to remove it because it was hanging out. There we are. Look at a slither of skin. I'm going to reopen the ear canal. It's a bit at the top, probably midsection, just past the second bend. We'll just get this out for the patient. And then we're going to go towards the eardrum. So again, I'm just tucking in past that second bend. Going to get the eardrum into focus. Going to just reduce the brightness there, just ever so slightly. And it's a little puddle there. May not be very apparent at the moment. But when I go in with the sucker, we're going to remove that. Or at least most of it. Some of it is fine. It looks, we just don't want it to create a puddle. A bit of oil that'll help to moisturize the patient's skin because it is really dry and flaky. So it's right in the inferior recess. You can see it's getting guzzled up. There we are. And the eardrum otherwise looks okay. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.